Hello everyone, welcome to 2050 Healthcare. Today we have with us Dr. Subrat Bhuyan, acting as a senior consultant, 2050 Healthcare. Welcome, sir.
Thank you, ma'am.
We shall be discussing the intricacies of a rehabilitation process today. Dr. Subrat, would like to know, could you please explain what a stroke and traumatic brain injury is all about and how it affects the body?
Stroke is a complications of physiological complications, we can say, and traumatic brain injury that happens because of a mechanical injury. Okay, there is a two different basic difference is there. We can say stroke happens because of any kind of internal problem, such as increase of blood pressure, any kind of clot inside the arteries, or because of some kind of arterial stenosis that may happens inside the heart. Any kind of infectious causes also may lead to a stroke sometimes. But traumatic brain injury is a condition that happens because of any kind of mechanical trauma. Mechanical trauma means any kind of physical assault, road traffic accident, head injury. Let's take an example: a person falls from a height. So there is a large impact that can happen over the brain. So that can lead to an injury. So it also comes under a mechanical part of injury. But in terms of recovery, if we'll say, the mechanical injuries are quite faster to be recovered, but the physiological injuries, which is stroke, brain stroke, that happens because of any kind of internal injuries, like I said before, that takes usually more than usual time to recover. So generally recovery status are quite similar. 6 to 8 months will be the brain recovery status, but the mechanical injury usually takes quite faster time, 4 to 5 months, but sometimes it may take also more than usual time if certain kind of complications are there, such as diffuse axonal injury or any kind of severe intense of hemorrhage that can penetrate to the more deeper level of the brain. Okay, but in case of brain stroke, that also depends on the recovery status will be depends on the age and extent of injury, aging factor, along with some kind of comorbidities such as constant blood pressure, maintaining any kind of aneurysm if it is there. So there might be chances of restroke that may happen. Because of that reason also we can say recovery status can get late. Okay.
Okay, so essentially, I would like to know from you,
Yeah.
what is the role of physiotherapy
Okay.
basically in this entire journey of a person ailing from a stroke?
Okay. So physiotherapy is a part of treatment. But so most probably we can say we are the one of the most specialized medical practitioner that we can easily employ our strategy in order to get the recovery, because we mostly deal with the movements and mobility in terms of coordination, balance, and stability most probably. So these techniques and these professionals mostly deal with the joints, muscles, tendons, and ligaments, and the stability factors in order to provide the proper muscle recovery. And our techniques doesn't only limited to the uh, particular factors of the muscle, tendon, and joint. But also we also treat other conditions such as balance problems, any kind of problems with the patient's ability and in coordinations, right? So physiotherapists are that kind of professionals. They are acting very fastly and very quickly after the 24 hour to 48 hours of the recovery of the brain. So there is a say like more earlier you will get into the therapy, more quicker the recovery. So how you are getting into the rehabilitation, how quickly you are getting into the rehabilitation, that is very important for the people, so that the recovery will be quite faster, because there is a specific time frame.
So I have a question here, Shubrat. So when exactly or what tentative timeline
Okay.
is there that a person should reach a physio rehabilitation or maybe a physiotherapist
Okay.
so that his recovery process can accelerate?
In this context, I would like to say the recovery status will be getting better as quick as possible. A patient can get into the rehabilitation, because there is a particular time frame is there, and that is equal for everybody. Most of the people, not only the traumatic brain injury, but also the brain stroke cases. So usually whenever there is a say in the medical term, if I'll say, whenever brain injury happens, the brain will go for a shock phase that is called as brain shock phase. In that phase, that will happen immediately after the injury. That shock phase means all the reflexes of the brain will be completely lost, and all the ability of the brain to identify and recognize will be completely lost. After the time of recovery, that happens immediately after the brain injury, 24 hours to 48 hours, that means 2 days later. So at the same time, all the recovery starters will be getting started. So as soon as possible, all the reflex starters will be getting started. The person will have to get inside the rehabilitation unit. So physiotherapist role in that case will not only improve the proprioceptions and the perception of the body, but also improve the joint flexibility, extensibility, and improve the blood flow to the brains, because there are certain techniques are also there, such as we can use the side mobilizing techniques, bedside positionings, patient mobilization like supine to sitting posture. It's about, let's take an example, a patient is long term bedridden, and after that patient needs a proper mobilization in order to improve the blood flow to the brain, because brain doesn't get the oxygen when the body is continuously in a bed. So physiotherapist's responsibility is to make them sit on the bedside, so that it will also enhance the blood circulation to the brain and the other part of the body. So it means there is a time frame will be 24 to 48 hours. That also depends on the critical conditions. If the injury is quite severe, at the time you have to go for a surgery, so it is not possible for a case to start the physiotherapy within 48 hours. So at that time you have to discuss the things with the surgeons as well, because once surgery will be done, after that time also you can get in the physiotherapy. That also may take 5 days, 6 days also, but within the time frame also we can get the physiotherapy. Because after the surgery, it's a case of let's take an example, it's a case of craniotomy, when the skull will be removed and it will be opened up in order to remove the stress inside the brain, because intracranial pressure inside the brain will be increased once the brain injury will happen. So at the same time, the surgeon's responsibility is to remove the stresses. That is what that term is called as the decompression. They will decompress the compression. Okay. So after that, once the decompression will happen, the neuronal channels that was not going before will be quite faster. Okay. At the same time, our responsibility will be more prominent in order to improve the status of recoveries, right?
Okay, so what are basically the first steps of recovery you people undertake when a patient comes to you?
Okay, so there are various kind of parameters are also there. So accordingly, we'll have to decide whether the patient is stable or not. So once patient will get into the rehabilitation unit, we have to first see the GCS score, that Glasgow Coma Scale. There are 3 parameters are also there: eye opening, motor response, and verbal response. Eye opening is how far a patient can open the eyes with a verbal stimulation or a touch stimulation. Let's take an example. I will touch the patient like this and ask the patient to open the eyes. If a patient is responsive with my single command, that means it's a good prognostic result. That means patient is in a less risk mode. Okay. And if conversely, if I'll say I am asking persistently despite the touch, if patient is not responding, then this is a bad response from a patient. So we can say the patient is not responding because of the brain extension of injuries will be quite higher. Okay. So that comes to the eye opening. Then coming to the verbal response. Verbal response means we have to talk with the patients. Please open the eyes, open the mouth, bring the tongue out. All the things we have to discuss with the patient. That will be one-on-one session will be patient and the doctors. But the patient will have to answer this and respond as quick as possible. He hears. Okay. But sometimes what happens, patient doesn't hear. Okay. So at the same time, we
Basically, when they're in
yes,
subconscious
that will
state.
be a subconscious state and any kind of stupor state. And the stupor state means you have to give the constant stimulation to the patients. After the constant stimulation, patient will be arise from the unconscious state. Then again, once you stop your stimulation, the patient will again go for the sleep. Okay. So then coming to the motor response. Motor response means movement of the bodies. Like usually paralytic side, we do not go for the movement examination, because paralytic side will be completely in a dead mode. So we have to go for the normal side, because let's take an example, left side brain injury is there, so right side will be the affected side. So we have to check for the left side, because this side will be the normal side, because we can't count on the affected side, because the patient is in a subconscious state. He can't be able to respond to my command to the affected side, right? So I can easily ask the patient to lift the unaffected hand like this. Please, let's say for the command, please lift your shoulder, left shoulder. Then he can lift like this if he can understand. Okay. Otherwise, we have to deal with in a different way. Okay.
So basically, what kind of problems normally do the stroke patients face?
So there are different kind of problems the patient may face. The stroke is one of the most leading cause of physical disability nowadays. So it can give you lots of more complications in terms of physical inability or impairments. The most of the people usually get suffered with their inability to move either, or there is a lack of support from the body. Muscle will be lost and paralyzed. Along with that, blood flow to the brain as well as body will be lost. Muscle mass will be reduced in their size, that is called as muscle atrophy. So because of long term immobility that can happen. And along with that, some of the people do not have any kind of cognition capacity. Cognition capacity means they do not have the capacity to engage themselves with the interaction. And that may only happens in the case of left side head injury. When the injury happens to the left side, it is the dominant side as we consider, and it supplies to the mostly the speech areas, right? So there are aphasia, it may happen. Wernicke's aphasia and Broca's aphasia, both the aphasia are quite different. Wernicke's aphasia mostly it is called as sensory aphasia, mostly receptive aphasia. That means if a patient is diagnosed with the Wernicke's aphasia or sensory aphasia, at the time if you are saying something, he cannot even get it, because even though you are saying, he
Patient
cannot
is not
understand
a
it.
receptor.
Yes, the receptive capacity will be quite less.
Right.
But in contrary, there will be another aphasia is there, that is Broca's aphasia. Broca's aphasia will be the motor aphasia. Okay, in that area the things will be quite different.
There
Okay.
basically the motor skills are developed.
Yes,
right?
motor skill will be quite yes, motor skill will be quite lost, and at the time even though patient is receiving the things, but the expression part will not be there. Okay, so we have to deal with in a different ways by stimulating the vocal cords and giving the some kind of stimulation, deep brain stimulations, and interaction mode at the help of other professionals such as speech therapist and speech language pathologist. Okay, and apart from all these things, some people may not have any kind of balance. Coordination, tightness, long term tightness can be a cause, and because of that also patient may hinder themselves with the time of rehabilitation, because it also gives them lots of pain. And sometimes patient also gives you some kind of night pains. Night pain also may happens because of the shoulder injuries. So because subluxation can happen over the paralytic areas, the muscles surrounding the shoulders are not that much capacity to hold the shoulder against gravity. Because of that reason, when person is sitting in a sitting mode or in a standing or even walking, the gravity is constantly giving the pressure towards downward, so that there might be a chance of subluxation. The muscle will be pulled, and there might be a chance of pain. Okay, this kind of problem patient usually face. Okay,
So post assessment,
Yeah.
like commonly, what are the techniques you people use
Yeah.
to recover the patient or aid the patient, help recover faster?
Okay. So there are different kind of techniques that we use nowadays. Very modern techniques has also been incorporated in the rehab sectors. The let's start with the conventional way of approaches, then going to the modern. So conventional way of approaches are that kind of approaches that we used to use, mostly the manual therapies, relaxed passive movements,
Right.
and proprioceptive neuromuscular facilitations, and the passive range of motion exercises, active assisted range of motion exercises. Passive range of motion exercises are that kind of exercise that we execute when a patient doesn't have any capacity. Let's say the patient doesn't have the power of muscle power is grade 0. The patient doesn't have the capacity to lift the shoulder and the arm with his own effort. So at the same time, passive movement can be helpful. When coming to the active assisted means the patient is in a condition of the hemiparesis. Paresis means there is some kind of movement is there. So there is a two difference between the paralysis and paresis. Paralysis means there is a complete loss of the movement, and paresis means there will be a movement, some kind of movement will be there. Even though you will start incorporating some strategy, still patient can cooperate up to certain extent. Let's say if the left side paralysis is there, if you are asking a patient to lift the shoulder, then he can lift up to this. After that, he can't be able to lift it. At the same time, the responsibility of the physiotherapy is to hold the hand and support it and complete the next range. Okay, so this is about the techniques of the active assisted range. Once the active assisted range is completed, then patient will go for an active range when the patient has the capacity to lift the shoulder automatically. So at the same time, physiotherapy can also incorporate some strategy. Apart from all these things, PNF strategy, proprioceptive neuromuscular facilitation that I said before. So in this technique, we need to we always execute certain kind of connections between the brain with the body. So there is a say, whenever you are incorporating these movements repeatedly, there will be a connections between the brain with the body. The term is called as neuroplasticity and neurogenesis. So more quicker we induce the movement, and more faster and more regularized and count will be increased, more faster the neuroplasticity will be. So neuroplasticity is a term which is used to describe the connection between the brain to body, so that the movement will be improved. Okay, so let's coming to the modernized techniques such as electrotherapy modalities we use. And mostly the functional electrical stimulation nowadays that we have had over here, and that we use in order to improve the functional strategy. And suppose a patient has got all the ability intact, and still the patient can be able to perform certain activities, such as let's take an example of holding a glass and holding a bottle to drink the water. At the same time, you can put the electrodes in different places to enhance the contractions, so that along with the machine stimulation, the patient is asked to perform the holding. So that machine is supporting the patient, while as the patient is performing the movement in the same area, the activity will be done completely. Then coming to the certain parameters of PMF techniques, that is kind of pain modalities that we use, and to reduce the pain like lower back pain and shoulder pain. Sometimes we use the TENS and IFTs, and sometimes also other instrument techniques or instruments that we use, like balance ball. And gradually, once the patient has got the ability, we start with the ball exercises and mat exercise that can be done over the floor by putting the mats, that include the kneeling and quadruped posture, and some kind of rolling activities, and physiotherapy assisted movements. Okay, then gradually, when the patient is getting the ability, then he can go get into the instrumental rehabilitation. Instrumental rehabilitation means quadriceps stable rehabilitation. Isokinetic, that he may use some kind of instruments such as weight cups and theraband, resistance band, or loop bands, to improve the more strengthening strategy. So that can be also a part of rehabilitation nowadays. So those people who are affected with the shoulder injuries and any kind of hip injuries because of the paralysis, they can also be helpful with that strategy. So this is all about the recovery status. So it's not only those physiotherapist role to incorporate, but also patient's responsibility when they are getting it, and how they are correlating the things, because they will have to get into it and cooperate with the physiotherapist, so that the things will be getting improved and getting better.
So, any latest techniques you people are using or
Yeah.
incorporating to
Yeah,
help these patients?
latest techniques such as pararobotics and robotics. Gait trainers are the most important techniques nowadays most of the rehabs are having with, and that can be used by some kind of chest strap and the pelvic strap that are comes with. When you can attach the patients, those people who do not have any kind of capacity, they can put with the strap, and we can make them work with that help of the strap, and there will be a bar will be given over the side of the machine, which can control the height of the patient. You can also put it directly independently over the ground. You can put it over the treadmill as well. So treadmill training can be done when the patient is able to walk properly. If a patient doesn't have any kind of capacity initially, we do not do that. Initially, we will start with the general walking with the help of that gait trainer. So once the patient will have the ability to walk completely, then we'll start with the slow training with the treadmill, and gradually the speed will be increased. Okay. Then coming with the robotics. The robotics is a most advanced techniques that is just recently been incorporated, and because of the expensiveness and the extravagant natures, nowadays very less amount of rehabs are employing it, because it's really expensive to purchase. But it is proven to be effective, and mostly the abroad companies along with abroad countries, they are using it in order to foster the recovery. So we have had that technology inside our rehab. We also put the machines inside the patient's body, and patient can easily get the ability with the help of machines. Usually we had to perform everything by our manual efforts. Nowadays machine can be done. Shoulder movement, leg movement, hip movements, everything can be settled down by the machines only. You need to put the patient into the machine, like machine, there will be a particular frame will be there. So the you have to set the parameters, what are the strength is available, and machine will let them work, and machine will allow them to move the balance and prioritize the functions according to their capacity, so that it will be very much easy for the patients to work. Earlier time, the therapy, despite therapist approaches, there was lots of complications from the patient side, like instability, fall was the complications. But with the help of robotics, the injury level will be minimized and the treatment status will be getting better. You will get the more recovery, muscle fatigue, like patient may get some exertion.
Yes.
After the physiotherapy, but with the help of robotics, the exertional level will be reduced. Patient will be quite active, and patient may enjoy the treatment session. So it will give us the better recovery as well. So in the same term, neuroplasticity will be improved.
Okay. So is there any proper critical recovery period after stroke where rehabilitation is more effective?
Okay. So there are particular period for every areas in the brain whenever the recovery, whether the recovery will better or recovery will take some more time. So according to the Brunstrom stage of recovery that we always follow, the Brunstrom, the theory usually started at 1950. So it states that there are 5 stages of recoveries are there. So according to the brain stages of recovery, the body also recovers. Okay. So brain usually starts with the flaccid stage. Once the brain stroke happens, the rule says once the brain injury happens, the always body goes for a flaccidity. Flaccidity means there will be no tone. That means body tone will not be there. So that will be like fail body, this kind of things. That means even though you will lift the hand, the body doesn't have that area to hold, that capacity to hold you. Okay. So patient cannot even recognize that area, okay, as a part of the body. So it start with the 1 month, 1.5 months of the recovery, and then gradually go to the spastic stage. Spastic stage means the gradually tone of the brain will be recovered and tightness will be generated. Sometimes patient may complain like we are getting some kind of tightness, but the tightness is not a part to worry, it's a part of recovery status. So more the tightness will be there, that means brain is getting more engaging itself to recovery. Okay, so our responsibility is to reduce the tightness in such a way so that patient will get the normal ability. Okay, so all these parameters will take this 4 to 5 months. That will be the time of critical care of recovery. Okay, so this is called as qualitative time of recovery that I say. So in that time, patient will have the ability to get up from the bed, will have the ability to communicate sometimes, and patient will have the ability to stand up by himself, and barely help of someone he can also walk. Okay, so this is a time period when it lies in between 4 to 5 months sometimes. Okay, but it is universally accepted to every stroke patients. Okay, for same for the traumatic brain injury. So after the 4 months or 5 months period, that next 8 months and 1 year, that will be the quantitative phase of time when the recovery will be getting slower. Okay, many people might have seen the whenever the brain stroke happens, at the same time after the brain stroke happens, the recovery will be quite faster within the month of 2 or 3. So patient usually ask us, why does the recovery happens so faster initially for the 3 months? Why it is getting late after that? Because it's a brain pattern of recovery. Once brain will recover the shock phase, it will surpass the shock phase. The recovery will be quite faster within 3 to 4 months. After that, recovery will take very less amount of time, and it may extend up to 8 months or 1 year. In that time, patient will get the ability, patient will get the coordination, hand recovery, and all the cognition capacity, okay, and independence, we can say. So hand recovery will take usually more than usual time. So legs muscles and lower limb, usually leg muscles are quite faster to recover because it has supplied with larger muscles. So in the medical terms, if I'll say, larger muscles means more motor unit it is being supplied with, the smaller muscles of the hand, so less amount of very smaller motor unit it is supplied with. So that's the reason more complexity of function is maintained by the hands and upper limb, and very gross activity is maintained by the legs, that means standing and walking. So very precise function of the hand, such as, like we can say, lock and key activities and playing a piano, writing, this kind of things are very fine activity. Okay, so this takes very long time to recover.
Right.
Okay, so legs will take very less time to recover.
So basically, we can deduce that the sooner we get into rehabilitation, we have least chances on missing out the qualitative recovery part, right?
Yes, yes.
Okay. So, Dr. Subrat, we would like to know, like, what are the biggest challenges these patients face during this rehabilitative journey?
Nowadays, patients are quite because of environmental status, we can say, or because of the stress from the families, we can say. So there are lots of strains the patient may get, like emotional disturbances and some kind of depression, and ultimately lead to a frustration, right? So most of the patients I have seen in my life after the stroke, because they're like confronting with most of emotional challenges, because stroke also affects the limbic system. There is a medical area, so anatomical area is there over the brain. The area is called as limbic system. So most of the time the limbic system, when it gets involved, that mostly controls the emotional patterns of the body. Okay, mostly the emotional things, emotional memory, any kind of perception, how we talk, how we engage ourselves. In the same way, once the injury happens to that area, so patients are affected with the emotional disturbances. So emotional disturbances not only happens because of the injury, but also the surroundings. Sometimes what happens, the as the brain stroke happens, it may create lots of burden to the family, not only physically but also economically. So they cannot manage their finances properly. Because of that reason, there will be some kind of constraint between the spouse and husband, sometimes the father and daughter and their son. This kind of things also I can face. Okay, so this is a common complication nowadays that happens. But in that way, once the patient gets into the rehabilitation, sometimes they can also feel like it will for them it seems like more challenging than it used to be. So patient usually express their like, sir, I can't perform it because my body ability is not that much. My body is not allowing me to do that because I'm getting lots of pain. The pain is quite excruciating. Then this kind of pain are quite like profoundly happening nowadays. So because of that reason, that will also seize the rehabilitation part. Sometimes it also reduce the rehabilitation potential of the patients. Even the patient has the capacity, we have to counsel them so that the patient can get into the rehabilitation. But in my opinion, our responsibility is not only to treat the case but also to counsel them so that the patient can also feel free whenever they are rehabilitating themselves. Okay, this is all.
So most of the time, we have seen patients get demotivated.
Yeah.
They get into depression, or maybe they are in a very challenged state,
Yeah.
and they do not accept the therapies as they should, right? So, how do the physiotherapists help in keeping them motivated? Like, what do people do
Okay.
for that?
So in our rehabilitation sector, there are lots of other things are also there. But one thing I do believe is, so we should always start with the communication, right? Communication will be the very important thing. It's a easy mode of interaction, because once we'll do communicate with the patients, they can they can feel friendly. Okay, some kind of most of the things, yeah, of course we have got the plenty of people with the younger ages with the stroke, but most of the cases from the belongs from the older ages group are quite childish kind of nature they have. So they are quite stubborn in nature. They do not even listen to us.
Right.
They usually think like whatever they are saying exactly they are right. This doesn't happen because of the injury, that happens because of their age. They
Right.
feels like they are the superior, so that whatever they will say accordingly everything will happen. So we do not need to like irritate on them. Okay, we have to be very, very particular about their behavior, and we can also talk with them quite friendly mode. So along with that, sometimes we also discuss the family issues with them, so that we can also give some idea what exactly the cause of their stress, so that we can also give them some kind of better advice to take some kind of rest, and you can deal these things in that way. Because some patients I have seen in my life, they come to me and directly whenever they do the therapy session, in between that session they usually get mixed up with me, and usually from that side they usually ask me what sort of things I can do, sir, this kind of thing I am facing, and this kind of issues I have been facing with my son-in-law and son. What sort of advice would you like to give? Then in that same way, I have to be very particular about their apart from my treatment, I have to be very particular about the in a general human terms. I have to give the opinion in a very genuine mode. That should not be any kind of bias mode, right? So apart from all the communication, also sometimes we also play musics with them, and some kind of hilarious movements, hilarious activities, and so that the patient can feel like they are in a homely environment. They will not feel like they are treating as a patient. They will be treated like they are grandfather and grandmother to us. This kind of behavior also we do need to give, so that they will feel whenever which environment they are, the environment is not quite like strict full environment for them. That environment will be quite friendly, so that everybody will be quite friendly in a mode, so that they will be very easy. That will be very easy for them to get accustomed with us, right? This is all about that we do most probably.
So basically, like patient counseling and family counseling both are essentially important,
yeah.
right? So, Shubrat, can you just help me out, like to highlight what basically is the role of a family
Yeah.
during this rehabilitative process.
Okay. So nowadays, many people are getting aware about it. So, stroke is a common cause of
Right.
disability nowadays.
Right.
So, as social media platforms are also quite active on it, so it's very easy to identify the conditions and the causes or the recovery status. So, because of in that way, if I'll say the patient attendance should be very much like proactively engage themselves in terms of recovery, because they should not feel like the stroke is quite dangerous condition, it may lead to a death, because most of the people have the false perception about it. So stroke is a condition that will lead the patient into the disability, it may take lots of like time to recover. I have seen this kind of things, I have heard. Because do not go for any biasness, because this kind of deceptive attitude can lead to a complication. So because of that reason, I would always suggest the family members to very calm and cool. Any doubt you have, please ask the professionals, medical professionals, so that we are here to help you directly, because each and every condition has got different parameters of recovery and different area to deal with.
Right.
So you should not like encounter with a direct opinion like, okay, this is a stroke, means the recovery may happen very late. This doesn't happen always. So sometimes
Right.
recovery happens within the month of 3, sometimes recovery happens within a month of 2, sometimes recovery also takes more than usual time, and 1 month and 1 year even, or 1.5 year even.
So it differs from
Yeah,
case to
it, yeah,
case.
it differs from case to case, and extent of injury and aging factor as well. So younger ages may take very less time to recover, whereas older people will take a very long time to recover. So that also depends on the extent of injury. So family members will be quite supportive. They should quite supportive to the people, so that what will happen, the complication will be minimized, even though patients are in a depression mode. So when they always want the family member as by their side. So if the family member will be quite supportive, it will be easy for them to recover and motivated towards the rehabilitation and the other treatment as well, right? So it will also reduce the depression, stress, frustration, the ability to speak. Okay,
So that will help our physiotherapy sessions
to getting easy.
Yes,
Okay, so we can also engage ourselves and employ our
and we can
techniques.
see better
Yes,
results.
better results.
Right. Well, Dr. Subrat, like, can stroke patients completely recover with physiotherapy?
Yes, I'd like to say in this context, physiotherapy mostly it's a diligent professionals. They work to restore the strength and flexibility. In terms of mobility, balance, and in coordination, most probably, and stability and perception, awareness. So the muscular capacity or all the physical inability can be restored by the physiotherapy, but some things that is not there, which cannot be done, like which is not there in our hands sometimes, like inside injury patterns, the extent of injury, right? So of course this is the general awareness, and that is a general thing that everybody knows. Once the brain gets injured, after that all the problem happens, because the brain different areas supplies to different part of the body, and they are designed for the specific functions. This kind of devoted functions are carried out by the brains only. Okay, so when the injury happens, let's say it's a clot, embolic stroke or hemorrhagic stroke, some kind of other medical intervention is also needed, right? Some medications or surgical patterns. After that thing, okay, when the physiotherapy merges, okay, at the same time the recovery will be quite faster. So it's all about both the things, both the medicines and the physiotherapy. So both the things will have to incorporate 50-50%. So physiotherapy is as much as important as the medications as well, right? So that the patient should not feel like only medication can heal the patients. So most of the people usually say they are quite like curious to know what kind of medication is there. Sometimes I have got some patients complain like, sir, what are the medications to improve the muscle strength and to reduce the joints tightness? This kind of, there is no such medication is available. I don't know about the future, but as such, I do not have any idea. Such kind of medication is there. Only by the physiotherapy means we can say the things can be recovered, because we are working to enhance the muscle contraction and flexibility and the tone, strength, power, stamina, everything based on the physiotherapy only. So it's the role of us which can render our services in order to get the recovery, right? So it's all about the treatment.
So, like, I can deduce that bearing a few aspects,
Yeah.
like we can expect a person to recover fully
Yes,
if he is
of course.
into a proper
Yeah,
physiology.
definitely. Because once the patient gets into the medical setup, at the same time, the neurologist, they usually meet the neurologist or the medicine specialist. They usually gives the medications to counter that effect, right? So after that, when the stability, what are the devastations that also comes with the inability and the muscle, or we can see in our eyes, right? That kind of things cannot be done with the medication. That is the foremost part for the physiotherapy, most probably, that we only incorporate our techniques in order to get the recovery. So patient, the recovery status completely depends on physiotherapy when the patient comes to the rehabilitation unit, because apart from physiotherapy there is no such technique is there, because always do not count on the patients to do the things with the medications, right? So
Right.
physiotherapy is the vital part for that, because we are the trained professionals, we are design our techniques in order to improve the strategy to get the recovery faster, right? So apart from medication, physiotherapy can also give you maximum results, right?
Okay. So, Dr. Shubrat, I would like to ask you, like, obviously, it's not that once we have a stroke, we cannot have a second one, right?
Yeah, yeah, yeah.
So, basically, what are the lifestyle changes one can adopt
Yeah.
so that, we can minimize the chances for a second stroke?
Okay. So there are plenty of things nowadays that we can also get into the practice so that the chances of stroke is reduced. Of course, there are lots of things are also there. As we know that the stroke can be caused because of the sedentary lifestyles and lack of rest, lack of sleep, and lack of exercise. We can say obesity, diabetes, blood pressures. So once the stroke happens, there is no such chances that we can say we can guarantee to that person doesn't have the second stroke. Okay, there might be chances. Some patients will have the stroke within a month of 2 or 3 or within a month of 6, right? So at the same time, I can advise those people to have the medication properly, do the exercises, and always keep themselves away from any kind of stress, and always do the meditations, and have proper sleep at least 8 to 9 hours per day, because sleep cycle will have to be maintained properly in order to maintain the hormonal balance inside the body, because endocrine functions always gives the proper result when a patient always go for a proper sleep, okay, which is completely away from any stress, right? Then in the leisure time they can do the yoga, they can listen the musics, the peaceful music, so that their brain will relax and get soothing effects, right? And medications, most of the people get the second stroke, their history, if you'll see the history, we can get a common thing. Either because of the forgetfulness or because of stubborn attitude, they do not take the medication constantly. Because of that reason also stroke may happens. So if you are encounter with a fast stroke, so do not take it granted that you will not get a second one, because there might be a chances you may get, okay? So because of that reason, I would say medications is the prior thing. Always take the medications. If you want to change something, please ask to your nearby doctor or any doctor you are suggesting. So it will be a good idea for the people to get to know exactly what are the conditions and complications that may happen, okay? So in physiotherapy terms, if I'll say, you have to very particular about the session timings decided by your physiotherapist, so that you have to get into the play whenever you are getting into the practice, so that you have to be very particular. Some people do not even know so how to
Right.
complete the sessions. They usually, once they will get the ability, they will usually take the physiotherapy as a regular part of life. They do not they do not care about the exercises, but exercise is an important part, not only train the body but also train the brain, because brain is also an important part of exercise. If you will do that kind of continuous sessions, it will improve the blood flow and remove all the exudates, all the unnecessary things from the body, and the fat deposition will be quite lesser. Apart from that, patient will have to very focus about the diet factors, because we should not allow patients, I should not allow patients to eat any kind of high cholesterol diet, because mostly proteinous diets and high cholesterol diet is not advisable, which can lead to cholesteremia, and we can say the fat deposition. So they will be very particular about that also, right?
Okay. So, lastly, I would like to give you like, I want a message from your end
Yeah.
for all the people or the families who are already dealing with some of the family members who have or had a stroke earlier or are in the same process right now, or to the ones, God forbid, who will be having one in future maybe.
Yeah.
So, like, any message for them for the hope or recovery?
So I would like to say to everyone, so there are many trained professionals are there nowadays in our field. So you should not take the things into your count always, because most of the people usually take the Google search and search by nearby things and ask to their nearby friends what exactly to be done. It's better idea, it's best idea to go to a hospital nearby, wherever it is and wherever you are, so that the trained professional, the doctors are there and trained medical professionals are there, they can also guide you properly for that. And most of the people nowadays do not even know what are the complications of the stroke. So I would like to tell them, as soon as you will get into the hospital, within 4 hours time period, the recovery status will be getting better. The time period will be decided by WHO, that is the 4 hours, and can be it is also decided by the American Heart Association and Brain Association. The time says within the 4 hour of time period, if you go to the hospital, the recovery status will be getting better. So as quick as possible you will reach to the hospital, more the chances of recovery will be. Okay, so do not count on your timings and do not wait for anyone's instructions. Then there are different kind of parameters are also there for the stroke, because most of the people do not know how to identify stroke. So there was certain things that I would like to tell all of the people. There was B fast, BEFAST, to identify the stroke. B means balance, E means eye weakness, okay, F means facial drooping, and A means arm weakness. The patient may not have the arm ability, and if you ask the patient doesn't have the capacity to lift the arm. And as for speech, the patient doesn't have the speech, the patient may staggering with. If you'll ask his name or her name, patient can be able to speak with. And T is for time to call the doctor. So as quick as possible you will get in the hospital, you will get the things. So always remember, speech ability and the facial weaknesses and the arm weakness is the important parameters to know whether stroke is happened or not. So once you are seeing all these things, then definitely you have to go to the hospital, because most of the people do not have also idea that stroke happens to those people only with the blood pressure, because this is a clear cut biasness. Because I would always say the stroke always happens to the people who doesn't have any blood pressure in their history, because blood pressure and stroke is a abrupt phenomenon. Okay, whenever you are walking, wherever you are sleeping, whenever you are doing some activities, that doesn't mean only that you do not have any stroke. The stroke can happens to anyone at any time. So blood pressure, those people who are not affected with the BP, those some people usually complaints are, I didn't have any BP in my history before, then why did I get this? Because in my to answer this, I would say BP is an abrupt phenomenon. It can happen, it can increase anytime. So because of that reason, the stroke may happen. Okay, the walls of the arteries which supplies the blood, because of constant stresses, the walls of the arteries will be getting thin. They cannot take the pressure more. So once the blood pressure will increase abruptly, because of the lack of inability to hold the blood pressure, what will happen? The artery will be getting burst. Okay, so there might be a chance of hemorrhage. Okay,
Right.
so once you are getting all these things, whatever I have said earlier, the face weakness, arm weakness, and speech inability and eye weaknesses, I lead may fall like this. In the same way, you may immediately come contact to the doctor so that they will better advise you. So the time period will be 4 to 6 hours, and 4 hours will be the minimum time. As soon as you will get into the hospital, they will do the CTs and MRIs done, and whatever the treatment procedure, conservatively it should be needed or surgically it will be needed, they will decide and give it to you. After that, you have to get into the rehabilitation as quick as possible for the better recovery. So it's my urge for every family members, do not count on the Googles, because Googles are the completely deception. They do not have any kind of clear cut informations, because we are the trained professional. We are here to guide you, because we have got the plenty of knowledge regarding that. Plenty of research are also being carried out in order to identify the more like complications and the causes of the stroke behind. So we are also finding that if you want to know something, please ask us, because we can betterly guide you than anyone. Thank you.
Thank you so much, Dr. Subrat. So thanks for giving us your time and informing all the people like
Yeah.
what exactly has to be done in case one has a stroke, or maybe in a history of his family, or maybe if we want to avoid one in future also. These are the steps we need to take care of.
Yes, ma'am.
Thank
Definitely.
you so much.